about it. Or let's just say we didn't put it together, or let's just say you refused to do the testing. No one would ever have known about this gene. And no one would ever have given this family the opportunity that it now has. And so really, when you think about it, her death and the knowledge we learned from the two of you has an opportunity now to save these daughters from the same fate. Sure enough, we tested the son, and because he also inherited the mutation, we tested the daughters. One of them inherited the mutation and one of them did not. The one who inherited the mutation is now actively proceeding. She lives in England, actually, and we connected up with one of our colleagues there, and she's doing breast MRIs there. She's doing some other prevention modalities. She's okay. She's not depressed. The other one obviously knows that she's not going to get her aunt's fates. But this was an opportunity that would never have come to save lives here for generations. And it's a huge and important thing. And I think if we don't understand that there's a vast amount of information in this generation, and by the way, there's a whole bunch of people over here, and we sent out letters, and they're all aware of what they can learn from this too. If we see how it empowers us and gives us an opportunity to prevent something that could otherwise come, it's really a great gift. So that's really the message. That's what I'm here to talk about, although I'll answer questions about anything today. That's what I had to say.
Do you advise men to have a mammogram once in a while?
The only time that men are routinely advised to have mammograms are if the doctor is trying to define something that they feel. So it's not considered screening, but if there's something going on in the tissue and they can't really tell what it is, they may do a mammogram to help define it. We've asked the question a lot as to whether we should be doing mammograms in men if we detect this mutation. And it's a very complex question in the sense that the reason women have mammograms done is a combination of the nature of their breast tissue and how hidden things can be. The fact of the matter is, in a man with so little breast tissue, things are not going to be hidden the way they are. But I'm not sure that this question is completely answered, and I'm not sure that we aren't going to start to do mammography in men who have the gene when we get a little bit more sophisticated in our data. So the answer is we aren't doing it, but it's not an unreasonable thing to do.
All right, now I have another question. If a woman has had implants in her breasts, is she still susceptible to breast cancer?
Yes, okay, so let me indulge in this. This is the chest wall, and here is the breast. Okay, and here is the tissue going up to the nipple of the breast, and these are all the ducts. And here is a muscle, and here's the rib cage, if you will. Okay, when you have an implant and you don't have any surgery otherwise to your breast, basically all this breast tissue is here. Only now, I think they brought me some other sides. Basically, you now have a big ball here, or in some women it looks more like this.